All right. Hello and welcome to our webinar. We're going to go ahead and get started. We know we'll have a few people joining us as we dive in here today, and we are also going to be recording this webinar for future use with some of our different marketing materials and potentially in our newsletter later. So as people are starting to join, just note that we are muting all of the participants. So if you have any questions as we go, we will save some time at the end to answer those. And please feel free to just go ahead and drop any questions you have in the chat box here on Zoom. All right, so to dive right in, my name is Jessica Bryan. I am the Director of Business Development at SRT, Service Robotics and Technologies. And I'm really excited to be here today to talk a little bit more about COVID response and building space utilization. And with me is our COO, Karoline Pershell. She's going to be taking on the bulk of the presentation. Karoline, do you want to just give a quick intro on your background?
Sure. My name is Karoline. I'm a mathematician. I've worked in across government, industry, and academia before coming to SRT, again, with evaluation and looking at how program implementation happens. So this presentation is really through a program implementation lens and how you're evaluating programs that match what you need, and also how do you establish if they're achieving what you wanted them to hit.
Great summary. Thank you so much for that. So as we're diving in here today, of course, our intention with this webinar is just to help provide some thought on how building data can support some of the changes that are going to be required as we all get back to work after COVID. And, you know, we can imagine that for the people on this call and for some of our audience that's going to be watching this later, you're grappling with some tough decisions and having to make some hard choices. And, you know, depending on the industry you're in and the area that you're working in, some of this is really high stakes for you. And so we just want to give an acknowledgement that we recognize the seriousness of this topic. And, you know, we decided to put this webinar together because we are a software platform and we have lots of conversations with our clients about how they're working and what they're working on to get back to work. And we realized that in some ways we have a pretty unique front row seat to some of the different approaches and strategies and thoughts that people are having. And we wanted to share some of the things that we have uncovered, and as well as some of the expertise that we bring to the table. So just to give a quick bit of context, Karoline, do you want to share the deck and we can talk a little bit about, I just want to lay a little groundwork on who and what SRT is, so that as you're diving into this webinar with us, you'll understand the context and where our perspective is coming from. So at its heart, our platform is called the M1, and it is a software mission control for smart buildings. So we are a software-only company, and what we're able to do with our software is actually integrate a variety of hardware and sensors and data streams into one place, giving our customers one dashboard where they can view and access all of the different data and information that they need. And our platform also has some capabilities around automation and scheduling that allow us to create really customized and nimble solutions for our clients. This webinar is not going to be all about our product and our platform and everything that we do. Instead, we really want to focus in on some different ideas on how you can approach return to work and returning to public space. But we did want to give a little bit of background on our platform so that you understand that the conversations that we are having are all about the tools that our clients are trying to use to help make sure that they are able to return to work safely, monitor situations proactively, and make sure that they have access to all of the data that they need to make smart decisions and optimize their resource deployment. So there's a little bit of background on SRT. I'm going to go ahead and throw this over to Karoline to take us into some discussion on building data and space utilization. Thanks, Karoline.
Thanks so much, Jessica. So really quickly, right now is a screenshot of one of the CDC's websites about protecting yourself around coronavirus. On top of managing facilities, intermittent periods of those facilities being empty, staff at home, staggered staff schedules as they return to work. When you layer on CDC recommendations, OSHA guidelines, expertise papers coming out of trade associations like for HVAC, and then trying to keep all of this with an eye towards ADA accessibility, there's a lot to sort through. when deciding what next and what to implement. If you've been even lightly tuned in, you've heard the fundamental guidelines that we need to follow to reopen. Sometimes the guidelines can feel like they're at the 30,000 foot level. What I have on the screen now is the very basics: maintain good social distance, wash your hands, clean and disinfect, cover your face. This guidance from the CDC and OSHA is advisory in nature, and it doesn't give the clear rules towards how you want to actually implement on the ground. I do want to highlight that the existing OSHA general duty clause requires employers to provide employees a workplace free from recognized hazards likely to cause death or serious physical harm. So when we are talking about a pandemic, how you are reopening matters. So let's just go ahead and jump into the next slide I have, looking at these workplace solutions in context. And then we're going to understand how to take action by giving you some examples of where we are working with clients. We're going to focus today on the parts that we know, which is tech, data, and analytics, and then how this fits into the bigger picture. I am not saying we have the solution. I'm expecting that your group is already pursuing your own solution, but that tech implementation is one component to this. So what's the greater context that we're working in? First, of course, is it time to reopen? This is a decision that you and your business has to make based on your clients, your employees, your leadership, what your actual value add is, and then, of course, aligned with national, state, tribal, and any other local guidelines. So we're not here today to help decide if you should reopen. Let's assume you've already decided to do that. What we want to help on is, how do you meet some existing guidance and actually implement to create a safe workplace for both your employees and customers? And then how do you plan for ongoing disruptions? Absenteeism, policies that allow employees to work in flexible ways and that help keep those who are coming into the building safe. So I want to talk to you about the framework we're going to frame most of these ideas in. And this is OSHA, and then CDC has pushed to it as well. It's the hierarchy of controls. So this is the OSHA recommended practices for safety and health programs. And what I have on the screen now is this inverted pyramid. And the idea behind this hierarchy is that the control methods at the top are potentially more effective and protective for employees and staff than those at the bottom of that pyramid. So whenever possible, you always want to start from the top as you try to implement and then work your way down. Let me give just a really quick example that explains what some of these levels are. So imagine that you have a space near your workspace where there's an outdoor area, there's some excavation happening near the bottom, and then some sort of upper level precipice near the top, perhaps some sort of old stairwell that heads down to the bottom. To eliminate the hazard, you would either fill in the part where the excavation is happening or build some sort of earthen berm down to it, like literally removing the opportunity that someone would fall. Substitution would be if instead of trying to use this rickety staircase, you actually put in some sort of elevator system. And both elimination and substitution are usually very hard to implement and very expensive. And the reason they can't be removed is because they are at the core of whatever the business is intending to do. So the next level where a lot of tech will be implemented is at the engineering controls level. So how do you actually isolate people from the hazard? So in this situation, it might be that you have some railings that go down the stairwell, railings at the top to keep people who are unaware where the edge is. Administrative controls are the ways that you're asking people to change the way they work. So this might include signage that reminds people that the stairs aren't all the same height. And finally, if you weren't implementing any of those, personal protective equipment in this situation would be asking people to wear harnesses and sort of belaying off at the top. So this is a really physical example that we can use to get our minds around what this hierarchy of controls is and how you would implement it. And what we're going to do is talk about what is the safest way to eliminate a hazard, and what does this mean for your business as you're trying to put this in place? Again, tech implementation is usually supporting something at the engineering controls level, but on these upcoming examples, I'm going to show you how we actually touch on many of those other aspects when you're implementing a solution. And the reason I do this is I really want to hit home that for an intervention program that's going to change the way workflow happens to be successful, it needs to be comprehensive. or basically just throwing tech at it isn't going to solve it. So how do you make sure you have all the pieces in place so that this can be achieved? Finally, what I do want to highlight is that you're going to need to adjust. If you are looking at the OSHA practices and even the CDC guidance, a lot of these were put in place, in my example, talking about handrails next to a stairwell, not talking about global airborne pandemics. So think about how you're going to translate this and the recommendations. Okay, so the next 6 slides, plus a 7th, which discusses an aerosol modeling tool by the National Institute of Standards and Technologies. These next 6 slides are going to be these major ideas. What are the basic preventative techniques that we all know and we're hearing about mitigating COVID-19 transmission? And then we're going to talk to you about how we've been working with clients to understand how they can use technology to implement some of these solutions. Again, we're going to focus on what we know, tech, data, and analytics, and how tech implementation is one component of your solution. And none of this is anything you can't do yourself. If you find that you're trying to implement programs for your work location, our process is that we are just combing through CDC and OSHA guidelines, line by line, unpacking what it means to implement it in each location, what activities would support that, how tech would simplify or improve that implementation. And then once you get all these things listed out, only then going back after that brainstorming period and swiping at them with an eye towards what has greater impact, what do budgets allow for, and so on. All right, so the first one I want to highlight is early symptom screening. And this is interesting because I indicated early on that very few things can be done at the elimination and substitution level, but yet that's what this is attempting to do. So right under the title here, I've got the documentation from CDC that highlights what's being asked. And then in italics, I have some of the statement from CDC about, in this case, staying home. Basically, if you're sick, don't come to work. So we know that some businesses are performing these manual assessments, surveys as you come in, temperature scans, and then requiring sanitizer and masks. There is opportunity for manual error, and it places frontline examiners at additional risk, those who are actually gathering this info, taking the temperature and so on. And so where you look at where early symptom screening fits in this, it really is at the elimination phase. The idea is that if COVID has not entered your facility and you are able to keep it from entering your facility, then you have a safe workplace for everyone who is inside. So this is really a high-level goal, should be aimed for. So that's the attempt with elimination. Engineering controls is going to be how we actually implement some of this. And you'll notice that it's going to also require some administrative controls, which I'll talk about on the next slide. So as a software integration company, what we do is we can work with personal health monitoring systems. Some have access control restrictions. So this is something like thermal cameras that scan as people head into the building, and they position alerts as to whether someone has a temperature that's off spec. There are some units that are even self-contained units where a person has to badge swipe enter. And then if they are, if it's noticed that they have, say, a fever, then they actually are not allowed to enter out the gate that would let them into the workplace. So this alone is already a new and interesting technology, but standing alone, it's not always the most useful. What you'd also want is to integrate that with HR software to report absenteeism and alert supervisors if someone is sent home. And then also to integrate that with UV lighting for sanitizing. So if you have people who enter and then who are deemed that they have a fever and they should head back, you don't necessarily want the next person to enter that portal right away. You'd like to sanitize that with the UV light disinfection. So the administrative controls on this not only are going to be how do you make sure that you're creating workplace policies that allow people to go home? You know, you've said if they're sick, don't come to work, and how are you actually supporting that? And finally, another tiny piece to think through is that this process takes anywhere from 10 to 15 seconds to do the scanning. So how do you then need to stagger people arriving at work so that your attempt to space people out doesn't mean that they're all waiting tightly in line to go through this scanner? All right, so the next piece that we address with clients right now is planning for absenteeism. And this is building off that previous early symptom screening. So you've screened, you've determined someone has a fever and they should go home for the day. So now how are you planning for potentially a reduced workforce? Again, the guidance on preparing workplaces for COVID-19 is a document with OSHA, the Department of Labor, and Health and Human Services that's cited at the top there. And the quote is where the quote comes from that documentation. So what are we looking at for planning for absenteeism? What we recommend are engineering controls with a technology component, and then the administrative controls that allow for absenteeism to happen without people being concerned about losing their jobs. So for example, if you have fewer people in the workplace, you need to think about who's unable to do the jobs they normally do on site. SRT's core custodial product supports remote monitoring and automation of systems for the cases of reduced staffing, or as a means to reallocate staff to higher priority tasks. A reduction in facility staff means a reduction in that informal daily manual inspection that happens across facilities, meaning that minor issues can become major problems. So facility staff know their buildings better than anyone, but without being physically in the space, their ability to notice these minor issues and address them before they become major problems is no longer possible. Which would mean that there's an increased possibility for machinery failure, facility damage, or even malicious activity. So our software, or any remote monitoring software, can provide means to monitor aspects of a building. And so I have some listed there: HVAC, water, air quality, access, inventory, lighting, pieces that don't require the person to be on site, but then can send alerts, updates, and predictive maintenance request to prevent system failure. Something I'll point out, an example, the second bullet at the bottom, single point failure systems monitoring, as well as predictive maintenance. We had worked with a school district, and on a Friday afternoon, it turns out that their temperature, it turns out that their refrigerator went out on a Friday, meaning that on Monday when they came back, they lost a week's worth of school lunches and breakfast, somewhere around the $100,000 at a cost of about $100,000. This is what we refer to as single point failure systems, where there's not that backup, and usually just the eyes on would have said, oh, we have a problem. So deciding what systems and prioritizing what should be monitored for that when there's less people on staff matters. We also had a warehouse that we've been working with, and they wanted to, for a warehouse, they are a necessary component in supply chain logistics, and pandemic proofing for them meant automating as much as possible. This allows them to increase output during this time when it's needed, but it would also mean, by having more automation there, that should people fall ill and you have reduced workforce, that they're still at least meeting the existing output needs. So those are two ways that planning for absenteeism has mattered, but just the general idea of remote monitoring. The next one that hopefully we all know is hand washing. So COVID-19 has been devastating because of its ability to live on surfaces for long periods of time and its easy transmissibility between people. But it is not hard to kill. It is not a superbug that has, morphed because of antimicrobial soap. It's actually very simple to kill just with basic soap. So that's to our benefit. According to the CDC, thorough hand washing kills up to 99.9% of the virus and is our best hope in reducing that spread. So therefore, to address health concerns over returning to a physical workspace, it's imperative to keep soap and hand sanitizer dispensers from running out. Specifically, a client that we're working with is a local municipality. They are developing their COVID-19 return to work plans. They have more than 50 buildings, and then as well as manage somewhere around the area of 70 to 75 parks, trailheads, and so on across a very dispersed geographic region, which have a bathroom on site there. So we propose to deploy our Mission Control Center for smart devices across facilities to provide this real-time data, the amount of soap left, the amount of hand sanitizer left, predictive analytics to let them know you've got about 4 hours until this needs to be refilled. And these real-time alerts can be sent to the appropriate staff when action is needed. So again, this is an engineering level control for the tech implementation, is having this smart network of alerting you about soap and hand sanitizer use, but it also requires personal responsibility in using it. So it also falls to the PPE level in how are you creating a safe workspace. So additionally for this school, this municipality, we have promoted incorporating UV sanitizing stations for phones and other devices like tablets. So UVC light kills pathogens, virus, bacteria, fungus, and it's best on hard, non-porous surfaces. Another benefit is that it doesn't give off harmful chemicals like a lot of these cleaners do. So let me back up. We know that hand washing is a major, one of the leading techniques we have in fighting COVID-19, but the phone should be considered now as an extension of the hand. So care should be taken to reduce risk of transmission by these devices. If you've washed your hands really well and your phone is contaminated and you pick that back up, you've essentially accomplished nothing by washing your hands. So how should we also be disinfecting phones and making that available for people? So these are just basic devices where it takes, I think, less than 3 minutes. You put your device in there and it does a quick UV scan of that. So including those in the same places where you would be washing hands or using hand sanitizer matters. Additionally, when you look to workplaces that use some sort of tablet scanning device, you can think of grocery check-in, you can think of UPS scanning on delivery. These devices should be sanitized between users as well. And so in addition to the small containers that can sanitize phones, there's these larger lockers that are available that can you can use to badge swipe in, check in the materials, the tablets, the whatever the electronic devices, charge them and have them sanitized with UV light. And then those can be checked out then again. So it also acts as some sort of asset and inventory control for those shared devices. And so I just wanted to make that tie again. That feels a little strange that I'm talking about the UV sanitizing stations under hand washing, but we have to remember how many things our hands are touching. And as I said, the phone is often considered an extension of the hand these days for many people. Okay, so the next item that I have listed up here is social distance and frequent cleaning. So CDC's reopening guidance for cleaning and disinfecting public spaces highlights that routinely clean and disinfect frequently touched surfaces. And then the second piece of guidance is maintain good social distance. So occupancy is the thread that's tying all of this together here. In order to help mitigate and limit the expansion of COVID-19, we have proposed systems where you identify regions of a facility where probability is higher for COVID-19 transmission. And then you can recommend optimizations to the cleaning team's process to most effectively clean, disinfect, and sanitize the facility. This is based on data collected from connected devices across a facility, monitoring foot traffic, occupancy, room access, and even the hand sanitizer or smart soap dispenser usage does tell us touch points for where people are in a space. So we bring together this data and then provide these geographical overlays and these quantitative results that show the areas of facility that have the highest probability or risk for COVID-19 transmission. Really simple example, in medical facilities, we know that we should be cleaning rooms immediately between patients coming back into them. And so that's done on a really standardized schedule. But the difference now is that people don't want to be in the elevator with each other. So now all of a sudden your stairwell has much higher traffic in it. So keeping track of that to say this needs a wipe down because of the number of people who've gone through this much square footage over this condensed time frame does matter. And this is what these alerts can send into. What this also does is it really changes the idea of how you would use a cleaning team. Cleaning used to be, and has been, usually done on a scheduled basis. And this really changes it to an on-demand, as-needed, real-time ask to keep track of areas. There's a few other things that are of interest here as we look at occupancy data. Occupancy data collected over this next year or so is going to be very important to leadership as we're all determining how do we actually use workplaces going forward in the age of COVID. So social distancing, frequent cleaning, and how this works with occupancy fits at both the engineering controls level of how we're reducing risk and hazard in a space, and at the administrative level. And the way it's fitting at the administrative level is, now that you have this occupancy data and you can see flow of people through spaces, you as an employer would be able to determine how are you asking or inviting people to use space differently. So for example, you might be finding that after some time, we all get caution fatigue and we're not 6 feet apart anymore. So asking and inviting your staff to remember and do this again is one way you can use this data. The other is to then examine your space and determine if how you have constructed the space is not allowing the staff to keep distances as are recommended. So a lot of important data comes out of some occupancy tracking, and that can happen at different levels of granularity, whether it's exact badging so that you know where a specific person is, or whether it's door counters, infrared fences that just kind of are doing a basic head count. And so we can pull that data together, and then you'd be able to use it for both the cleaning schedule and looking at what your staff needs with regard to how space is used. And this one, working on the social distancing and how frequently you should be cleaning, is tied to this next idea of contact tracing and then downtime. So there's two different ideas happening here. The first is that what is close contact defined as by the CDC, and for COVID-19, I have highlighted here, it's within 6 feet of an infected person for at least 15 minutes, 2 days before the illness to 2 days prior to positive specimen collection if the patient's been isolated. So that's one piece. And then the second component is that you're being asked to wait 24 hours before you clean or disinfect a space, or as long as you can, once a person who's tested positive for COVID-19 has been identified. So let's talk about the first piece. I think we've all heard a lot about contact tracing in the news, and so there's some idea of what that is. There are systems that allow you to tag individuals. If you work in a facility that has badging that's required anyway, Bluetooth low energy systems across building can easily help you find how people have interacted. And so this is an after the fact pulling data system where once someone has been identified as testing positive for COVID-19, you can pull their last 48 hours of interaction through the space and with others. And then this way you can warn others accordingly. Now, depending on what type of facility you have and what your model is for business, you can have both tagged individuals and non-tagged individuals. So when you have clients who can enter a space, they are usually not going to be badging in, and you're not going to be tracking who they are, but you can still have that head count to understand, again, some of these same occupancy issues. And so what we do is work on tying systems like that together and providing relative alerts and so on. A part that's really interesting right now is, again, this idea of cleaning. So we often talk about contact tracing with regard to knowing how close one person was to another, but you also need to think about contact tracing in where a person is in a facility. So especially this idea that says when possible, you should wait 24 hours. And then if you read further down the CDC guidance, it says, well, if you can wait 7 days, then you don't actually have to do anything different. No one's been there, but most of the time we can't close a facility down for 7 days. So the idea is, do you completely shut a facility down once you've had a positive test result? Depending on the size and the number of employees in your facility, this may become very difficult. So what facility contact tracing can do is look at where a person has moved through a facility and close down just those portions. And so when you talk about the CDC and OSHA guidelines for reducing threat, this is actually a substitution. So we didn't completely eliminate whatever the hazard is, but we substituted a process of closing down the entire space with being able to isolate shutdown of a space. And where this came up again was when we were working with the client who's looking at automating their warehousing. And consistent shutdowns of logistic supply chains are exceptionally problematic. So how can they instead do strategic and minimized isolated shutdowns if they can track where a worker is moving through the space who's been before they have to clean? So let me move next to another concern we're hearing often from clients, and there's a lot of media interest, and of course, rightly so, concern that's coming out of COVID being airborne. So how are air handling systems, how are HVAC systems potentially further spreading COVID-19? So data has come out that COVID-19 is detected as an aerosol. So aerosols are smaller than 5 microns, which is 5 millionths of a meter, I think. So previously we know that they're in, spittle, and that they can land on surfaces, and that's why you don't want to be so close to people, and so on. So now the concern is that there's actually aerosols, so much smaller components that can transmit the virus, and aerosol is so light and small it can be suspended in the air and remain infectious for up to 3 hours. So now you should have concerns about how does your HVAC handling system take air in and move it throughout the facility. So the American Society of Heating and Air Conditioning Engineers had a paper that just came out, I think in May, and the title of it's there at the top, has a lot of great resources in it. And the tone of this is a little tempered, in that while this is a possibility, it should be noted that other mechanisms for virus dissemination are likely to be more significant. If your goal is to eliminate all possibilities of COVID-19 in a workspace, the idea of leaving no stone unturned, then you should pursue how your HVAC system can reduce and at least not continue to spread COVID-19 throughout a facility. But what they highlight is that the probability in how this works is very low, and that other preventative measures have a much greater return on investment, which is always difficult when you're trying to plan for something that can potentially be deadly. So if you're able to do the no stone unturned approach, then what you can look at here is UV in duct configurations. So this is UV lighting, smart UV lighting, that's letting you know when it's working and how often. That is within ductwork. UV lighting can kill COVID-19. And so protecting occupants from UV light, having it in the ductwork, is one way that they recommend that. Now, there's other ways that smart systems can tie with your HVAC system and that meet the American Society of Heating and Air Conditioning Engineers requirements. So one is to consider how this is how your HVAC system, sorry, let me back up a step. A lot of their recommendations about improving the workspace environment and reducing COVID-19 transmission is to increase outdoor air ventilation to keep these systems running longer. But there's a lot of needs there that aren't as dry and easy as they seem. Whenever you are trying to reduce a hazard, you don't want to be introducing another hazard. So if your attempt is to increase outdoor air ventilation, our recommendation for clients is to tie that to outdoor air pollution sensors and weather monitoring, right? It doesn't help to bring in air that's going to make people sick in another way into your building. To keeping the systems running longer, 24/7 if possible, means you're going to be enhancing air filtration. And the HVAC automation that they are requesting happen now when people are in space should be dependent on variable occupancy. So again, this is something where we would suggest smart systems tying that in. We don't think people are going to want to be using conference rooms in the same way. And so if previously your HVAC system was tied to your booking availability on rooms, or it could or should be, you want that to now vary based on the fact that, okay, someone's using a conference room, 20 people for a conference. By the way, 15 of them are calling in remotely. How does your HVAC system adjust accordingly based on the number of people in the space? So that's the type of smart systems that we tie together. So that was let me just pause for a moment. Those were 6 examples that were highlighting these major basic pieces that we are hearing about in the news: contract tracing, hand washing, more frequent cleaning, worrying about occupancy. And that's really the place to start, the high quick return on things that will really affect your workspace. What I next want to point out is a tool here, and then I'll mention a second one that I don't have listed. Modeling, data modeling is a very useful tool to have in your back pocket as you're trying to understand potential problems in your space. As a mathematician, the first thing I want to say is all models are wrong, but nevertheless, they are very useful and intuitive for understanding what concerns you should at least have on your radar. So the one I'd like to point out here is called FATIMA. It's the Fate and Transport of Indoor Microbiological Aerosols. And this is a National Institute of Science Technology tool. You can find it online. It's free. It's an app online where you have to enter a good deal of information about everything from your room geometry to the type of HVAC system you have and so on. And they accurately model aerosols and how they move about a space. And when people breathe, cough, sneeze, they're going to release these respiratory droplets and these smaller aerosols, which can remain in the air for a longer period of time. The current data suggests that coronavirus is primarily transmitted through contact with the larger droplets, but these tiny aerosols can still harbor the virus and could pose a threat, especially indoors. So to establish a sound defense against these aerosols, informed management for airflow and airborne contaminants is necessary. And so what this model does is it can indicate where's the probability of these aerosols and droplets finally attaching. How much wall washing should you be doing? How much floor washing should you be doing? How should you be concerned about how the HVAC is kicking on? What you're able to do with this simulation is estimate the number of people in your space. You have to make estimates around who is infected or how many, or at least one, and then indicate how you should be adjusting your airflow, your cleaning, etc. because of that. So it's a really good tool. We recommend, if you haven't looked at it, to consider how that's going to influence what decisions you make. And the nice part is it gives you ideas for how to mitigate should things be looking worse, because you can see as you make changes how that should affect the contamination of the space. What we've been looking at doing is how you actually tie into that data modeling, giving alerts for surface cleaning or removing contaminants by bringing in exhaust fans or other air cleaning systems. Another piece that I'll mention, which is not listed here, is we're working with a group who's currently looking at behavior modeling of the spread of COVID-19 in somewhat closed systems. So in this case, they're starting off by looking at a university campus, but this can work across any facility, any company, in understanding how people's behaviors are going to up the risk of transmission of COVID-19. This kind of modeling, again, is really useful for understanding what sort of administrative controls you need to have in place. By that, I even mean things like requiring masks in the workspace, understanding who are compliant and non-compliant individuals, making assessments based on that, as well as high-risk individuals in the workplace. So if you're interested in understanding how that would apply to your company or your space, reach out to us and we'll put you in contact with the group that's developing that. So I've just gone through quite a bit pretty quickly. I hope you're all still breathing on your end. So next steps. You should be thinking about planning your own implementation. I'm sure your plans are far underway. And so, the question from us is, how does tech support what you're doing? So a few quick parting thoughts, because rushing to implement tech can always be troublesome if you don't think it through. The first thing I want to point out is to remember ADA compliance. When you are reopening businesses with these massive changes that are needed very quickly, it's very easy for some oversight to happen. So just remember, who is it that you're inviting back to the workplace? And then also remember that compliance is sort of like a complete minimum. You can always do more than that. A small silver lining to this is that a lot of the changes that are happening in workplaces support ADA compliance. And that would mean additional signage, but has your signage been developed, with font, color choice, size considerations in place? More spacious common areas, more spacious hallways with more things removed. So a lot of these are already supporting a lot of those compliance issues, but please just keep that in mind, especially as we rapidly change entry points, for example. The second thing I want to bring up, and this is something we think about all the time, is data security and privacy. You need to be concerned about anonymity versus confidentiality. We work hard in data security in the storage and the access. And, you should always do the New York Times test, of course, if your new policy is to be explained as the front page headline of the New York Times, how are your employees and clients going to feel about that? And when in doubt, get feedback from the employees before deciding to implement a system. At least hear about the concerns that you might not have otherwise had on your radar. And then finally, as you're looking to implement multi-use technology, you want something that can expand with your business. Our system was designed as a plug and play, flexible, intended to be modular base for adding different data streams, whether that's from smart sensors, robotics, legacy software. So in 5 years, when you want to add another data recording system, get different analytics out of it, and remove other pieces, we are that sandbox that you can play in. And so I'd encourage you to look for systems that are tied together and that allow you to expand for future use. Jessica, let me throw it back to you to quickly summarize everything I've just said.
No pressure, right?
Right.
No, you did a great job taking the group through so many of the different components that we're thinking and talking about every day. And, for everybody on the call, our contact info is up here on the slide. So if you ever have any questions about anything that we're covering, we're always happy to chat with you more and dive in a little bit on kind of your specific questions. We do have a couple of questions coming into the chat. So we'll do a little bit of Q&A. If anybody else has a question they want to add, please feel free to just click right on that chat box. It's at the bottom of your screen in the center, and you can type your questions in there, and then I'll go ahead and read them out and we can answer them. Okay, so the first question here is, should these plans be formalized as a document? Karoline, do you want to talk a little bit about some of the things that we've seen be effective with our different projects?
Well, there's the nice part of not having it in a document means that you probably can move quickly and not have vote by committee when you need to make quick changes. But formalizing the documentation helps to make sure everyone's on the same page, right? We all understand and expect what's happening, but when it actually looks different, that points out a communication gap. In a time when everyone is stressed, I fully support more and greater and clearer communication to reduce that stress. There are other benefits with regard to tracking and evaluation. And again, I'd really highlight that looking at the hierarchy of controls website that explains that inverted pyramid and how you assess the implementation and the fidelity of a program that you're implementing is useful, right? If you are putting the time and effort and funds into implementing something, let's make sure that it's hitting what you need. Keep in mind, though, that I come from an evaluation background. So when you said, is documentation needed? My thought is, what do you mean? More documentation is always needed.
Yeah, great comments. And I think, something that I'll add to that just for consideration as everybody is reflecting on their own plans for their own organizations. Our clients run the gamut from, military type deployment and implementation to, schools, universities, office buildings, hospitals. And so we have our fingers in a lot of different industries and places. And I would say that the documentation question varies a little bit depending on urgency and that longer term strategic planning. So I would say most of these come together with, some sort of sketched out plan to keep us all on the same page to get those things that everybody needs right away. Sanitizer devices and different types of occupancy tracking. But in each of these different deals and organizations we're working with, this pandemic has opened all of our eyes to a realm of sort of terrifying possibilities. And so a lot of that deeper planning is going into that longer term, what happens if we go into the building and then we have to leave it again? How can we, do better with our remote monitoring and all of those different things that Karoline talked about? And so I think, figure out where your organization sits. Some buildings are really innovative and tech forward and have a lot of this in place, and some, don't. And so depending on your deployment and where you're sitting, that answer could be different. Okay, we have another question. Is there a priority to the various approaches that you defined? It sounds like air handling HVAC is the lower priority compared to most others. What are highest priority? Karoline, you want to take that first?
Yeah, according to the CDC, highest priority is hand washing. And so hand washing and then accurate cleaning of surfaces. So the first way it's transmitted is we somehow put it on ourselves So getting it off your own hands, but then previously, what is it that your hands touched that got the virus on it that then you were able to put into some of the mucous membranes that actually bring it into the body? So hand washing systems, it's a little strange. Never before has it been a public health hazard if a bathroom runs out of soap. And that is where we are now. And so having systems like that across your building where you integrate and make sure that that is not just available, but you strategically design the spaces so that that is becoming the new normal, right? We're trying to put new patterns for how people function in space into play, and that's going to take a lot of support structures to make those happen. Luckily, fear is pretty strong right now. So that's helping drive people actually staying on point with that. So I would say that that's number one. And then the second piece that I would push is the occupancy, an understanding of occupancy. And again, as I mentioned, that's gives multiple aspects. So first it gives are people actually staying socially distanced? You can get that information and you can either chide your employees. As I said, I think it's called caution fatigue, as people are degrading in their carefulness on these behaviors. You might also realize that once you see that there's a problem, clear inspection of that is going to find that it's really not the employee's fault. There might be something structural about the space and the needs of how the workday flows that's not allowing people to stay apart. And so how can you change your workday? And I think a lot of this is going to be very important, as I mentioned, over this first 6 months, this first year, as different places aim to get back into the workplace, because there's going to be some differences and we don't really yet exactly understand how that will play out. Something that we talk about often in evaluation is to look for the deer paths. So if you've ever parked in a parking lot and you're supposed to walk up to the building, there's some sort of sidewalk that goes around the outside perimeter of the parking lot. You should get on the sidewalk and walk up to the door. And then there's deer paths, which are those beaten down tracks of dirt across the middle of the grass that actually is the shortest path up to the door. And so different places take this on in different ways. They tend to dig that out and reseed that and put more sod. But if the human behavior is that they're going to walk there, perhaps you should just pave that area. And so gathering occupancy data really lets you find the deer paths.
Great call out. One piece I'll add as well is we are seeing a little bit of what I call like flavor of the week. And some of this comes from, technologies being used in different ways or new technologies being released, and it creates a little bit of discussion. Or as we get back into buildings, people are going to be learning. Again, keep in mind, nobody actually knows exactly what can happen and what will completely protect the whole population. Otherwise, we wouldn't have shut down. So, I also am really encouraging clients to really think through when you're looking at different tools and technologies, SRT included, like we are among this group. You want to make sure that you're vetting for some future proofing and looking for systems that are really flexible and can be nimble as needs change or as you need to layer in additional components to help protect your protect your building and protect the people inside the building. And I think, just recognizing that everybody's in learn as you go mode. So be really kind of discerning for your space and asking good questions and using the resources that are available, such as the things that Karoline has shared, is really going to help make sure that you are investing in the right places and in the right tools that are going to help support those behavioral changes.
Jessica, let me add one more thing. As you mentioned flavor of the week, and I remembered the initial question about just what's most important that I do first. I did realize that perhaps I was a little too vague, and when people tune in because they want an exact answer. So I will give my opinion from the copious reading that we're doing on this. And I would suggest that looking at UV sanitation, that cell phones and other devices that people touch all the time are problematic. Now, whether or not you decide to bring in some sort of UV sanitation for devices in your workspace, or you prohibit them from the workspace, that's just another type of administrative control that can adjust transmission in a workplace.
Good comment. That gets us through everything in the chat. Karoline, are there any kind of final comments or thoughts you want to add before we end this webinar today?
No, just a reminder that webinars are so interesting because just it's complete resounding silence on the other side. So we hope that people reach out. As much as I enjoy talking to myself and the colleagues I talk to every day, again, we hope you do reach out as you have questions, concerns, or thoughts about how to move your own programs forward.
Yep, and we will work on getting this live somewhere that you can access it again, so that if maybe you're not in the thick of your project yet, or you want to use this as a resource and a reference, there will be a space where you can find it. And just want to reiterate, thank you all for coming today. We love having interesting discussions. I think so much of what we do has just come from kind of having a conceptual approach to, not only our product, but kind of how we're showing up in the world and what we're helping with. So we're always happy to talk. Don't hesitate to reach out, and we hope you all have a great rest of the day.